Hi everyone, welcome back, me again. Today's video I am talking about groin injuries and injury to the adductor muscles which sit on the inner thigh. And I'm also then going to talk about sports hernia, which is otherwise known as Gilmores groin or athletic pubalgia. So I'm going to talk like I do with, if you've seen any of my other sports therapy, sports injury related videos, I'll talk about, what causes injuries here, the risk factors, what the symptoms are, as well as, offering treatment options and some sort of, suggestions for basic stretches that you can do to help prevent further groin injuries. And as I say, then I'll also be talking about sports hernia as well. So in terms of, sports injuries, groin injuries probably account for about 2 to 5%. They're not, particularly common, but certainly they do happen, and they will be influenced by various factors. The anatomy of the groin is actually quite complex, and this increases the chance of injury, because we're looking not only at the adductor muscles and tendons and ligaments which lie sort of along that upper inner thigh and in towards the pelvis, but also you've got all the reproductive and digestive organs as well, which sometimes complicates things a little bit. Now obviously a lot of these sports injuries are caused by overuse, and so the symptoms generally tend to build up gradually with minimal pain to start with, and so it's really easy to ignore these kind of injuries. But if you are having an issue, it's really important to get diagnosed by a doctor or a sports therapist, because the symptoms across different types of groin injuries will actually be really quite similar. So sometimes misdiagnosis will happen. So if we look at people, the risk factors, who is at a high risk of developing injuries in this area, certainly there are certain sports, so things like football or hockey, which involve these sort of start-stop movements while running, but it can also be really quite common in sort of gymnasts, high jumpers, ballet, ice skating, and also things like rugby and basketball as well, and hurdling is another one. Not that that's a hugely common sport, but yeah. But also, if we look at teenage girls have a higher risk of stress fractures in the groin, and this maybe is just something to do with the difference in the pelvic anatomy of girls. Teenage athletes would generally have an increased risk for avulsion fractures, and this is because those pelvic growth plates haven't quite solidified yet. But also military recruits and athletes, anyone who's like increasing the intensity of their training, they're going to be prone to stress fractures as well. And the other thing for stress fractures is, if you suddenly change the type of surface that you're playing on, you know, we always say sort of to runners, you know, try not to run on hard sort of concrete surfaces because it's much greater impact. And likewise, you know, if you suddenly sort of go from, you know, playing on grass to playing on tarmac, the impact is going to be different, and so you're at higher risk of these stress fractures. And the other thing is that with regards to hernias, men are at a higher risk of hernias. So common causes of groin injury, you know, we've mentioned those sudden stops and starts of the lower body while running, so things like football and hockey, but any repetitive stress. So, you know, if you think about athletes, you know, like a triathlon, you know, where you've got repetitive stress on those muscles, or any, you know, sudden trauma. So with high contact sports such as rugby, if you know, get stuck in an awkward tackle, again, that could cause some injury. Short, intense training sessions, we mentioned about the military there, and also sort of certain athletes, you know, and it's important to just, you know, build intensity gradually, and you know, if you do these sort of short but like really intense training sessions, that often will put more, you know, stress on the muscles than a longer, you know, steadier training. But also, you know, if you've already had a groin injury, and, you know, you're in a rush to get back to your sport and you don't have an adequate rest period, this is also going to end up leading to chronic injury. So do take your proper rest period after any injury. So, okay, so let's talk about the types of groin injury that you may, you know, experience. So, most common one is a groin strain, which a lot of us have probably had at one point or another. Certainly if you go horse riding for the first time, you know, and you're walking around like John Wayne afterwards, and then yeah, you've probably done a bit of a groin strain. And so groin strain is really where these adductor muscles that we've talked about on the inner thigh, you've actually got 5 of them, and you know, the top 2 go right up into the groin there. So this is where one of those muscles will get pulled, whether it be a partial tear or a complete tear. More commonly, I would say a sort of a grade 1 or grade 2 tear in this area, you know, rather than a complete rupture of the muscle. So yeah, as we say, adductor strain, one of the most common injuries affecting those inner thigh muscles, which basically get stretched, you know, beyond their normal range of motion, and usually then stopping or, you know, starting suddenly. But other kinds of injuries we see in this area are avulsion fractures, which is where the tendons are torn at the attachment site, and again this causes pain and weakness then in the muscle. Stress fractures we've mentioned, you know, basically small cracks in the bone, which, you know, these will sort of form gradually over time with overuse and repeated movements. Quite often you'll see this in, you know, with repetitive stress in long distance runners. And certainly any of you out there who have had shin splints, which I've also done a video on, so do take a look at that. Yeah, you'll know kind of what these stress fractures feel like. Other maybe less common injuries. So there's something called Osteoitis pubis, which is very similar symptoms to an adductor muscle strain. You'll see chronic inflammation in the pubic symphysis, which is that part on the, if I can show you, so it's that part where the front of the pubic bone joins and you have that little bit of cartilage there. So you'll get chronic inflammation in that area, and also in the surrounding tissues, and again it's caused by repetitive stress. We mentioned about men being more at risk of a hernia. So a hernia, at this point I'm talking about an inguinal hernia, which is in the groin. Obviously you have other types of hernia as well. So this is where there is a tear in the lower abdominal muscles, which will cause that bulge in the groin area. And this is due to the abdominal organs pushing through the weakened muscle. And it's often, we see this a lot in weightlifters who basically are lifting weights that are really, a bit too heavy, and and the muscles aren't ready for it. Yeah, so that's something for you, weightlifters to look out for. So yeah, those as I say, I will go on to talk about a sports hernia in more detail, but certainly that is one of the injuries which I will mention briefly here. So as I say, otherwise known as Gilmores groin or athletic pubalgia. This is where you get tears in the muscle, ligaments and tendons, at the point where the lower abdomen connects with those adductor muscles on the inner thigh. But I will discuss this in more detail in a little bit. Other possible groin injuries, you've got a hip labral tear, which is a tear in the cartilage, often linked with femoroacetabular impingement, which again I have done a video on, so do take a look at that one also. Physial injury, which is basically a fracture of the growth plates due to overuse, and something called snapping hip syndrome, which again, that has been covered in another video when I talk, I believe it's in the hip flexor video, which will also be going up shortly, so do take a look at that video for snapping hip. Okay, so in terms of these groin injuries, what symptoms are you likely to experience? Well, obviously it's going to, vary a little bit depending on the exact injury that has taken place, but certainly sudden or gradual pain in the upper inside thigh where you've got those adductor muscles, which may get worse on bringing those legs together or adducting the leg, because that's when those adductor muscles are going to contract. Lower abdominal pain, which gets worse with coughing, sneezing, may be a very good indication of a hernia. A snapping sensation in the adductor muscle at the time of injury may occur. Swelling, bruising, pain with muscle compression, or pain that improves with rest but gets worse with any kind of twisting movement. Again, that may be a good indicator of a sports hernia. And that's, you know, with the twisting movement, that's because it's right at the bottom of those abdominal muscles, which is where the hernia occurs. Other symptoms with groin injuries will be things like stiffness, reduced movement, joint disruption. You know, you may have, if you have pain in the genitals, again, this is a good indication of a hernia. And, you know, you should really seek medical attention for that. Also, fever, nausea or vomiting. These are secondary symptoms which, you know, absolutely should, you know, you should seek medical attention again, and that can occur with hernias. And, you know, if you end up with a strangulated hernia, that is an emergency. And so if you're getting any of these symptoms, you know, again, get yourself off pretty quickly to a doctor or the hospital. So how do we treat these groin injuries? Well, again, it's going to depend on the exact type of injury that you've, you know, experienced. But, you know, these usual sports injury, options, rest, ice, compression, elevation. You know, the injury may heal on its own if it's allowed time away from sport. So, for example, if you've just got a grade 1 adductor muscle strain, you know, where just some of the fibres are torn, you know, just take a rest and it will heal itself. But obviously, you know, if it's something more severe, then, you know, you're going to need other treatment options. Ice to the injured area for 20 to 30 minutes max, every 3 to 4 hours over maybe 2 to 3 day period will really help to improve, you know, any inflammation and swelling, and which will consequently then improve pain. Compression, you know, you can get thigh, you know, compression, like a shoe grip type thing. You can also get even compression garments for the groin to help reduce swelling and just stabilize, you know, the site of the injury. And elevation, you know, elevating the groin area for a few hours each day may again help reduce swelling. You know, so how do you elevate your groin? Well, I guess you could stand on your head, but, you know, easiest way, just, you know, by popping, you know, a pillow or something underneath your hips. Non-steroid or anti-inflammatories, obviously, for pain relief, and again to help reduce inflammation, but do be careful with ibuprofen if you've got gastric problems or asthma or any cardiac issues. You know, physiotherapy, sports massage therapy, you know, isometric strengthening and stretching are, you know, brilliant for any kind of sports injury. And you know, in severe injuries, and again we're looking probably more at things like hernias, then you may be looking at surgery. So I'm going to offer you, before I go on to talk about sports hernia, I'm going to just give you some basic stretches that you can do to help either prevent groin injuries or to just help improve flexibility and range of motion and strengthen those muscles, you know, following on from an injury. Okay, so groin pain is often caused by tight or weak adductor muscles, which are these muscles on the inner thigh here, which leads to strains. So these stretches that I'm going to talk about now are just a basic way of preventing tightness in these muscles and improving flexibility, and can be used either before or after a workout. So the first one is this standing groin stretch. So you're just going to stand with your feet, at a good width apart, sort of just over hip width, and then you're going to push to one side with the uninjured leg, causing the injured leg to straighten, and you're going to kind of push away from the injured leg and sort of almost down a little bit to really get a stretch down these adductor muscles. The next one is this seated butterfly stretch, where you're going to sit on the floor, bring your feet together in front of you, and then with your elbows you can push down on the knees, and if possible get your knees down to the floor. A lot of you won't be able to do this, but it's something to sort of work, at going a little bit further each day to improve, the flexibility of these muscles. And again, you're going to feel that stretch on those inner thighs there, going into the groin. So the next one is this squatting groin stretch, where you will have your feet, much wider apart than your average squat, and you're going to basically point your toes out to the sides and basically then flex the knees and hips to squat down, and using your hands on each knee, on the inner each knee, you're just going to use your hands to pull back on the knees, pull them back sort of towards your body while you are squatting down, and again you'll feel that stretch just on the inside there. Okay, so then we have this supine groin stretch. So this is sort of similar to that seated groin stretch, but this is kind of an easier one to start off with. So you can lie on the ground, put your feet together, and then you're just going to bend the knees up and then let each side drop down to the sides, and then you're going to push down using these leg muscles. You're going to push down each knee as far towards the ground as you can. Now the next one is a hip opener stretch. Now this will actually, this is a common exercise for the hip flexor muscles at the front there, but it will also, not so much on the adductor muscles here, but it will work into the groin a little bit as well, so it's still worth doing this one. So you're literally gonna kneel and then bend one knee up in front of you and stretch the other leg behind, and then you're just going to push forward while keeping a good upright posture, shoulders down. You're going to push forward at the front of the hip there, and you'll feel that stretch down those hip flexors and into the groin. And then the last one, this is a really good stretch for those adductor muscles on the inner thigh, going right up into the groin. So you're going to sit on the floor, spread your legs as wide as you can, and then you're just going to slowly lean forward, placing your forearms on the floor in front of you, and obviously then the further sort of forward you can lean and the closer you can bring your head down towards the ground, the greater the stretch along here. So just work slowly, gradually move the arms forward, gradually bring your head down to increase the stretch as you become more flexible. Okay, so I said I was going to talk about sports hernia or athletic pubalgia. Sports hernia is basically a strain to the soft tissue, so that could be to one of the muscles, one of these adductor muscles on the inner thigh going into the groin. It could be a strain to one of those, or even around the lower abdominal muscles. Or it can also be a strain to one of the tendons, ligaments, or nerves. And as you can see, there is a wide variety of muscles around this area. You've got the abdominal muscles and the obliques coming down here, which actually come down to the bottom of the pelvis. And then you've got these adductor muscles that we've been talking about, of which there are 5. And then going obviously down into the quads. So basically the sports hernia, it will occur at this point here, which is circled. It occurs at the point right in the groin there where these abdominal muscles meet the adductor muscles. So it is quite a definite area where, all of those muscles meet this pubic bone that sits underneath. So risk factors for sports hernia, similar to the groin injuries really, anyone who plays real vigorous sports that involve these sudden movements, sudden stops and starts, things like hockey, football, wrestling, rugby, these athletes are going to be at a higher risk. Also professional athletes that obviously just tend to push themselves, a fair bit harder. Sports hernias do generally affect males, potentially anyone whose core muscles, so we're not just talking about the back muscles, we're talking about those abdominal muscles that are weaker than the thigh muscles, and this is because it could increase the impact on the torso during those sudden stops and starts and twisting motions. So it's always important to really keep those core muscles nice and strong. So causes of sports hernia, as we said, the sudden sort of stops and starts, so anything where you've got sudden planting of the feet, or twisting of the body, so like we said, football, hockey. Quite often this will be a gradual thing due to overuse and repetitive movements, but again it can happen due to a sudden trauma, and especially in things like football and rugby where you're getting tackled, that may well be the case. So in terms of symptoms of sports hernia, usually there will be a sudden severe groin pain at the time of injury. This will be a one-sided pain that is definitely worse when playing sport or twisting, but it will improve with rest. You will more than likely get bruising in the upper thigh and or the lower abdomen, just at that point where all those muscles meet. And and pain will certainly increase with exercise, that uses those abdominal muscles. So you're not going to be doing anything like stomach crunches because it's just going to be too painful. In terms of treatment, you're looking probably a rest period of approximately 4 to 6 weeks with no sport. You're going to obviously be taking anti-inflammatories for the pain, help ease inflammation, physiotherapy and massage, so sports type massage to strengthen the abdominal muscles and keep your core nice and strong, but also the leg muscles. But this will happen after that rest period. So it's not just a case of, have 4 to 6 weeks away from sport and then you're good to go. You need to actually then put in the time to, strengthening those muscles through therapeutic massage and also through those stretches that I've shown you as well. If if the pain and inflammation do sort of persist, you can look at steroid injections and nerve blocks to relieve the pain. But again, these are short-term measures, and you want to make sure that your muscles are strong enough, to be able to return without injury. And surgery, again, sometimes for hernias, surgery, is occasionally needed. So, yeah, that's really it for groin and adductor injuries. It's given you a sort of a basic overview. But as always, any questions, you can comment down below. Contact me through my Facebook or Instagram and I will answer you. And do subscribe to my channel because I've got a lot of other sports injury posts in addition to the medical ones. And I'll have more sports injury videos and videos on specific muscle groups coming up. So if you subscribe, you'll be notified when they come out. But for now, that's all from me. So take care and I'll see you next time. Bye.